We're going to finish up Chapter 15 by talking about hemostasis. So hemostasis means to stop bleeding, and there's 3 steps that are involved in hemostasis. The first one to occur is vascular spasm, followed by formation of a platelet plug, and then forming the blood clot or coagulation. Here's a picture of the 3 steps of hemostasis. The first one is vascular spasm, which we'll talk about next. And then that's followed by forming a platelet plug to plug the hole temporarily, and then finally the blood clot will form, and then that will be more reinforced and will last longer than the platelet plug. So the first step of hemostasis is vascular spasm. So whenever you tear a blood vessel, its reaction is to constrict the smooth muscle. So that will help decrease the blood loss if you vasoconstrict that blood vessel. And then immediately the platelet plug is going to start to form because we need to plug the hole to decrease further blood loss. So there's 2 steps to form the platelet plug. The first step is we need the platelets to adhere or stick to the damaged blood vessel wall. And the second step is platelet aggregation, where now we need the platelets to stick to each other. And we need the platelet plug to form in order to form the blood clot in the third step. So let's look at the first step of platelet plug formation, platelet adhesion. So we have some damage to the blood vessel wall. The collagen, which is the connective tissue that makes part of the outside of the wall of the blood vessel, will be exposed. And a protein that's just floating around in the blood called von Willebrand factor will stick to the collagen fibers. And then the platelets will grab onto the von Willebrand factor, and that's platelet adhesion. And then also when the platelets stick to the von Willebrand factor, that also activates the platelets and they start releasing their contents, which makes them start sticking to each other. Here's a picture of platelet plug formation, the first step, platelet adhesion. So when you have a break in the blood vessel and the collagen is exposed, the von Willebrand factor, which is a protein just floating around in the blood, that will stick to any of the collagen that is exposed to the blood. The von Willebrand factor acts like a handle that the platelets in the blood can then grab onto, and the platelets will stick to the von Willebrand factor, which is stuck to the collagen on the edge of the broken blood vessel. So that's platelet adhesion, where the platelets adhere to the broken walls of the blood vessel. So once the platelets have stuck to the walls of the broken blood vessel, the next step in forming the platelet plug is platelet aggregation. So this is where the platelets are going to stick to each other and rapidly form the platelet plug using positive feedback. So here's a picture of how the platelet plug is formed. So when the platelets adhere to the collagen by the von Willebrand factor on the broken edges, that activates the platelets and they will start secreting chemicals like ADP, and ADP will make the platelets stick to each other. And then the ADP will also make the platelets release more ADP, which makes them stick even more, release more ADP, they get even more sticky, and so you can see this positive feedback loop going on. The other chemical that's released from the platelets is thromboxane A2. Thromboxane A2 will help the platelets stick together as well and make the platelets secrete more ADP, which makes them stick more, and so we get more positive feedback going on. And so this will very quickly form the platelet plug, which will plug the hole and stop the blood loss. So we don't want platelet plugs forming where they're not supposed to be. So where the blood vessels are healthy, the endothelial cells continuously release 2 chemicals, prostacyclin and nitric oxide, which prevent platelet aggregation. So here's just a picture of a healthy blood vessel. The walls are just continually releasing nitric oxide and prostacyclin, which will both inhibit platelet aggregation. The third step of hemostasis is to form the blood clot or coagulation. Another name for a blood clot is a thrombus. So we need to reinforce the platelet plug. So we're going to do that by activating a protein called fibrinogen that's floating around in the blood, and we'll convert it into the active form of fibrin. And fibrin is going to form a net that is thrown over the platelet plug, and that will form the blood clot. So here's some electron microscope views of the fibrin clot, and so you can see how the fibrin protein forms this net, and you can see there's some red blood cells trapped in there, and this will reinforce the platelet plug and make it more sturdy. So in order to cause the fibrin clot to form, there's a clotting cascade that's going to be activated. So let's take a look at a picture of this. So this is the coagulation cascade. There's actually two branches. We have the extrinsic pathway, which is going to be started by some tissue factors that are released by the damaged blood vessel tissue. And then the intrinsic pathway is from blood clotting factors that are just floating around in the blood. They come into contact with the collagen from the broken blood vessel, and that will set off this coagulation cascade. Both of these arms, the extrinsic and intrinsic pathway, will then meet at the common pathway, which will then activate the prothrombin to thrombin, and then thrombin will activate fibrinogen into fibrin, and that'll form the fibrin clot. You do not need to memorize this coagulation cascade. There's a lot of different clotting factors that are involved. Calcium is needed to do this, and we also need vitamin K to make the clotting factors, which is what the liver makes. So here's just showing you the third step of hemostasis, showing you coagulation. So we've already had our platelet plug form here, so you can see that underneath. And when the collagen is exposed to the blood, we have some clotting factors in the blood that will then be activated, and they will start that branch, the intrinsic pathway. We've got a cascade going there. And then also the damaged blood vessel wall will release some tissue factors, and they will then start another pathway, the extrinsic pathway. Both of those pathways will meet and form the common pathway, and they will activate the protein prothrombin to the active form of thrombin. And then thrombin will take fibrinogen that's inactive in the blood and activate it to the fibrin. And then the fibrin will form that protein net over the platelet plug, and that fibrin clot forms the blood clot. And this is just another picture just showing you the two pathways of the coagulation cascade. We've got the extrinsic pathway started off by tissue factors being released by the damaged tissue, and then the intrinsic pathway, which is going to be started by clotting factors in the blood coming into contact with the collagen. And then here they meet in the common pathway, and then we're going to activate thrombin, which then activates fibrinogen to form the fibrin, and that'll get thrown over the platelet plug to reinforce it and form the blood clot. So about 30 to 60 minutes after the clot forms, the blood clot is going to retract. So the platelets actually contain actin and myosin, the contractile proteins we find in the muscle. And so the actin and myosin inside the platelets will contract, and that clot will then pull on the edges of the broken blood vessel and pull them closer together. And then that way the blood vessel, when it heals, doesn't have as much of a gap to try to fill in. About 2 days after the clot has formed, then we're going to start dissolving it, and it does take about a couple of days to dissolve the clot. So there's a protein called plasminogen that's just inactive in the blood, and it's going to be activated by tissue plasminogen activator. And then that will form plasmin, which will then start dissolving the fibrin in the blood clot, and eventually over a couple of days that blood clot will disappear. What's interesting is tissue plasminogen activator, or TPA, that can actually be given to stroke patients within about 3 hours of them having a stroke to help dissolve the blood clot that's formed. And just a couple of clotting disorders. There's hemophilia, which is a genetic disorder most commonly located on the X chromosomes. So we do tend to see hemophilia more in men than women. And just one of the clotting factor genes has been mutated, and so that person doesn't make the clotting factor correctly, and then that will interrupt the coagulation cascade, and then they can't clot their blood. Also, if a patient has liver disease, the liver makes all of the clotting factors, and if the liver is not working well, it's not going to produce very many clotting factors. So that's a big problem for liver disease patients. They do tend to have bleeding problems. And then also, if they're not secreting enough bile, you do need bile to absorb vitamin K from your diet, and also vitamin K is made by the bacteria that live in the colon. So it's a fat-soluble vitamin, and you do need bile to absorb that. So also with liver disease, we can't get enough vitamin K, and then we need the vitamin K to make the clotting factors as well. And so here's just a picture of an ugly liver. This is cirrhosis of the liver. You can see it's all lumpy and yellow. It's got some fat deposits in it. It's all scarred, and that liver is not working very well.